Yeah, I'm a king bee, baby, buzzing round your hide. Together we can make honey, baby. Let me come inside.
I hope that people recognize how desperately we need ways to detect cancer early. There's this enormous effort to try to deal with early prevention, early diagnosis, early therapies to avoid people having to undergo what are interventional therapies that all have substantive toxicities.
Ideally, the model would be that you could detect the beginnings of cancer, the very earliest stages, and have a strategy that would allow you to not only detect, but also to destroy. In breast cancer, I completely believe there is a role here. In lung cancer, where screening is just really taking hold, in many of the inherited malignancies where you know it's coming, you have much more ability to distinguish the population at highest risk, but all you have are the same old tools that just don't work very well.
I think one of the biggest issues that Earli could address right away in the clinic is actually the issue of solitary pulmonary nodules, which are a common finding on chest CT scan and which lead to a diagnostic dilemma. It's very difficult to sort out which of these are actually cancers and which of these are not cancers. The current standard of care would be in large part to follow these nodules over time to see which ones grow and which ones don't. That's a pretty dissatisfying answer for the patient, who may be very worried about the presence of a nodule that may or may not be cancer.
We've had imaging for a long time. It gets better and better, but it is difficult to figure out who exactly to target. How do you know what you're going to find? Even people with the very highest risk, we're not very good at individually predicting their risk. On the cell-free DNA or circulating DNA side, that's a great model for early detection when it delivers completely. At the moment, the sensitivity is not ideal and the specificity is not. You can not always find it, and if you find something, it's not always because there's tumor. And then what do you do when you find these early markers if you can't find other evidence of the tumor? Mostly you worry.
I decided to join Earli's advisory board because I was very impressed with the potential of the technology, not only in cancer, but in medicine in general. The notion that we can create sensors within the body to report on biochemical physiological processes just is a complete game changer with respect to the potential for diagnostic medicine. It would become the foundation for precision medicine because the problem is getting information on what's going on in the body. And at the present time, we have very limited sources for that. The technology that Earli is developing would allow one to measure the activity of any particular gene in any particular part of the body. It's just the ultimate in sensitivity and potentially in resolution.
Earli is, I think, particularly interesting in lung cancer. Lung cancer is larger than the next 5 tumor types combined in terms of the number of people that it kills, but doesn't get all of the attention for a variety of reasons related to smoking and stigma, et cetera. I think Earli can save tens of thousands, if not hundreds of thousands of lives if applied correctly in a lung cancer setting.
I think Earli can help determine within a lesion that just appears on a CT scan as a nodule, whether that nodule has the properties of a malignancy or a benign lesion. Those have very different metabolic properties, and some sort of technology like this that could help us sort out which of the nodules are actually cancer would be transformative.
And we've recognized over time that there are factors that limit the sensitivity of mammogram. And one of those factors is breast density, where this tissue is just very difficult to resolve, and even the most experienced mammographers cannot see. So I think the breast cancer community has known for a long time that although we have the gift of mammograms, this is not enough. It's really not a perfect test at all.
I think for cancer, the problem with detecting cancer from liquid biopsies is that the doctor would have to tell the patient that it looks like you have cancer, but we don't know where it is.
So Earli's approach is distinct from many of the other approaches that will have their place. But Earli's technology provides an avenue to move rapidly from detection to treatment.
We need something that takes advantage of the tumor biology to tell us it's there, rather than wait for it to get big enough to be detectable.
This is an extension that allows the imaging of biochemical and metabolic activity at an enormous sensitivity and resolution that I think will be Sam's legacy in diagnostic medicine.
The main reason I found it interesting is that there's only, with immunotherapy, the T cells can take out fairly large tumors, but if it's too large, then it's got a much harder job, and it's more difficult to get complete responses. I think it's greatly going to improve the efficacy of checkpoint blockade by getting in there before the tumors are so massive, and also cause changes in the tumor microenvironment that are suppressive. If you can get it early enough before those things have set in, there's a better chance of getting success with the immunotherapies.
Even maybe you get beyond the oncologist. Maybe you don't even need me. Maybe it's the primary care doctors that are now using the early detection tools, right? Because you can see it so much earlier before there's even a biopsy that gets you into my clinic to see an oncologist. And I think that's important too, because then you would really be able to say to the patients, this is where we've detected the area, the problem area, and this is what we can do for you, maybe from a surgical standpoint or a radiation standpoint, or even a molecularly targeted therapeutic standpoint, if you really let your mind go to where the future is for treatment of cancer patients.
In Earli's case, I mean, some of the things that are particularly exciting are things that, one of the things that I help on would be drug delivery systems of DNA and things like that. I think if you can do gene therapy to deliver drugs to tumors, that would be a really big deal. I think figuring out exactly where the tumor is, that's also a really big deal.
I've always emphasized taking on really important problems and problems that affect many people. Earli has the ability to do both of those things. Important problems, new technology, innovation, and changing the lives of many people.
This is an area where we have the potential to save thousands of lives if we get this technology right. That is an early intervention to actually detect and localize very early cancers could have a transformative impact on human health. We don't get a whole lot of opportunities in our life to make that sort of an intervention.
This is a magnificent blue ocean opportunity with a completely different approach than everyone else.
I think this is a chance actually to change the paradigm of how cancer is addressed by the scientific community. It's trying to prevent people from having progressive cancers. It's trying to get people when they actually can be cured and essentially live fully normal lives after it. And I think that's an exciting opportunity.
You guys are so far outside the box of what most of the companies that ask us to work with them are. Most of them are just looking for how to combine immune checkpoint therapy with drug X, and that's it. It's just another sort of standard clinical trial of putting two things together. Whereas you guys are thinking about what's the biology that's involved in getting the tumor cells to reveal themselves early enough so that we can now not only have detection, but we can think of therapeutically how to intervene.
Well, when I first heard about it, I thought it was kind of wacko, to tell you the truth. You could actually actually do that. But then when I saw the data and saw what you guys are doing, I thought this is a wonderful thing to do for really, getting everything started in therapy as early as possible. Buzzing round your hive.
Okay, how about now? Yes, now they are running.
Yeah.
What do you think are the biggest challenges for Earli to overcome?
Earli needs to overcome the liabilities of its CEO. So
Yes, biggest issue.
Yeah.
I think this is very cool that you're doing that.
Well, you can decide after you hear me play. It's like I said, it's
Yeah, we're going to have a jury out afterwards here.
Any parting inspiring words?
No, go Earli. How could the company possibly fail with such a fantastic name?
Okay, and here we are done.